Mental health first aid is a critical skill. Just as we learn physical first aid, we must develop competencies for psychological distress. 1 in 4 people will experience a mental health challenge, highlighting our role as first responders in daily interactions. This module equips you with skills to recognize signs, de-escalate situations, and connect individuals to professional care, offering immediate support before help arrives. Be confident and make a real difference. This training prepares you to be a crucial bridge between crisis and professional care. You will develop practical skills to recognize mental health emergencies, provide immediate first response, and connect individuals to resources, all while maintaining personal boundaries and cultural awareness. Your role as a mental health first aider is to offer immediate psychological support. This module focuses on mental health first aid, MHFA, teaching you to define its scope and limitations. You'll gain skills to recognize mental health crisis signs, apply psychological first aid, PFA, and ALGEE methodology for intervention. The objectives include maintaining safety and making appropriate referrals. These competencies ensure you can provide effective and ethical initial support as a first responder. Our structured approach begins with foundational concepts before progressing to practical applications. We commence with mental health first aid principles, establishing clear definitions and boundaries. Recognition training follows, developing your ability to identify crisis situations through observable indicators. The psychological first aid framework introduces evidence-based intervention strategies. ALGEE methodology provides systematic response protocols, followed by specific crisis intervention techniques. We conclude with referral processes, cultural considerations, and real-world application scenarios. Mental health first aid is a critical skill for supporting individuals in mental health challenges or crises. It involves recognizing signs, providing initial help, and guiding towards professional support. This training empowers you to assist those in distress, fostering a more compassionate community. You will learn key principles and apply them effectively. This approach recognizes that psychological distress needs immediate, compassionate response, similar to traditional first aid, but acknowledges unique challenges like internal symptoms, resistance to help, and cultural factors. MHFA offers initial help for mental health problems or crises, supporting individuals until professional treatment is received or the crisis resolves. It's akin to traditional first aid for physical health, providing immediate, compassionate care and emotional stabilization. Training teaches how to recognize signs and offer appropriate support, connecting people to necessary help without providing therapy. MHFA-trained individuals are vital in workplaces, schools, and communities. Understanding boundaries between first aid and professional therapy prevents role confusion and potential harm. Mental health. First aid provides immediate, short-term stabilization by trained community members. You focus on safety, support, and connection to resources. Professional therapy involves ongoing treatment by licensed practitioners who can diagnose conditions and develop comprehensive treatment plans. Recognizing these distinctions ensures you provide appropriate support whilst avoiding therapeutic overreach that could compromise the individual's well-being. Recognition skills form the foundation of effective mental health response. Crisis situations rarely announce themselves clearly. Instead, they emerge through subtle changes in behavior, communication patterns, or emotional expression. Developing observational skills enables early intervention when support is most effective. Understanding that mental health crises exist on a continuum helps you assess severity and respond appropriately. Some situations require immediate emergency intervention, whilst others benefit from supportive conversation and resource connection. Mental health crises are diverse. Suicidal ideation is the most serious, requiring immediate intervention. Panic attacks involve intense physical symptoms, often mistaken for medical emergencies. Severe depression can manifest as withdrawal or hopelessness, while psychotic episodes alter reality perception. Recognizing these varied presentations is crucial for providing appropriate responses and avoiding assumptions about underlying causes or necessary interventions. Mental health crises present with both verbal and nonverbal warning signs. Verbal cues include expressions of hopelessness, worthlessness, or threats, alongside changes in speech. Nonverbal signs involve behavioral shifts like withdrawal, agitation, self-neglect, or physical symptoms such as sleep, appetite changes, and unexplained injuries. Recognizing these patterns is crucial for timely intervention, but avoid overinterpreting normal stress responses. Sarah's scenario demonstrates how multiple warning signs converge to indicate serious mental health concerns. Physical changes like disheveled appearance suggest self-care difficulties. Withdrawal from normal interactions indicates social disconnection. Hopeless language containing future-focused negativity raises suicide risk concerns. Concealment behaviors, such as inappropriate clothing choices, may hide self-harm evidence. Recognizing these patterns enables appropriate intervention whilst maintaining sensitivity to individual circumstances and avoiding premature conclusions about specific conditions. Psychological first aid, PFA, offers evidence-based strategies for crisis intervention. It's a structured approach, unlike informal support, focusing on maximizing effectiveness and minimizing harm. PFA prioritizes immediate safety, emotional stabilization, and connecting individuals to ongoing support. These principles are vital for responding systematically to various crises, from acute trauma to mental health deterioration, ensuring a prepared and effective approach. The 5 PFA principles create comprehensive crisis response framework. Safety encompasses both physical protection and emotional security for all involved parties. Calming techniques help regulate overwhelming emotions and reduce crisis intensity. Self-efficacy empowers individuals to participate in their recovery process. Connectedness combats isolation through social support networks. Hope provides future-focused perspective during overwhelming present circumstances. These principles work synergistically. Addressing safety enables calming, which facilitates empowerment and connection, ultimately fostering hope. Active listening is vital for mental health support, requiring deliberate attention to verbal and emotional cues. Showing full attention demonstrates respect and creates psychological safety. Reflection techniques confirm understanding and validate feelings. Avoid interruptions for complete expression. These skills significantly enhance your ability to provide meaningful support in crisis situations. In a crisis, stay calm and reassuring. Use clear, simple language. Ask directly about suicidal thoughts if concerned. Validate feelings. Offer practical support. Respect personal space and boundaries. Be patient, allowing time to respond. Focus on immediate needs, not complex fixes. The ALGEE Action Plan, developed by Mental Health First Aid, is a structured framework for providing initial support in mental health crises. It serves as a mental health first aid tool. The 5 key steps are: assess for risk of suicide or harm. Listen, non-judgmentally. Give reassurance and information. Encourage appropriate professional help. Encourage self-help and other support strategies. ALGEE is the internationally recognized mental health first aid action plan, with each letter representing a key step. A. Approach, assess, and assist in crisis to ensure safety. L. Listen non-judgmentally, using active listening. G. Give support and information, offering emotional and practical resources. E. Encourage appropriate professional help, connecting to services. E. Encourage self-help and other supports, suggesting coping strategies. ALGEE's A. Approach, assess, assist. Approach in a private setting, explain your role, and ask permission. Assess for harm risk, directly ask about suicidal thoughts, and determine urgency. Assist by taking immediate action for danger. Call emergency services if needed, and stay with them. Always take suicidal thoughts seriously and seek professional help immediately. Create a safe space. Level positioning, eye contact, minimize distractions. Practice patience. Allow full expression without interruption. Acknowledge feelings. Use phrases like, "That sounds difficult," or "I see this is upsetting." Reflect and clarify. "So you're feeling," or "Tell me more," to ensure understanding. Being fully present and truly listening is powerfully therapeutic. Approach mental health discussions with empathy. Normalize feelings, validate concerns, express hope, and highlight strengths. Provide factual information about conditions, share resources, helplines, support groups, correct misconceptions, and explain treatment options simply. Ensure information is relevant to their immediate situation without overwhelming them. Encourage professional help from GPs, specialists, psychiatrists, psychologists, counselors, crisis services, and NHS teams. GPs are initial contact for referrals, specialists offer in-depth treatment, and crisis services handle urgent needs. To encourage help seeking, address barriers, offer practical assistance, finding resources, making calls, and share positive experiences. Always respect their autonomy, highlighting the benefits of professional support. Social support networks like family, friends, colleagues, and community groups can provide valuable emotional support. Encourage self-care strategies, such as physical activity, adequate sleep, healthy eating, and stress management techniques. Educational resources like books, websites, apps, and courses can help individuals learn more about managing their mental health. Peer support through groups, forums, and recovery programs can be a powerful complement to professional help. While these supports are important, they should not replace professional treatment for serious mental health concerns. This presents a case study scenario where a colleague, John, is experiencing a panic attack. I will guide John to a quiet place, assess his immediate medical needs, and determine that it's likely a panic attack rather than a heart attack. I will listen to John non-judgmentally and encourage him to share what he's experiencing. I will provide support and information, explaining that panic attacks are unpleasant but not dangerous, and suggest focusing on his breathing together. I will encourage John to seek professional help from his GP to effectively treat his panic attacks. I will also offer to share resources on helpful breathing techniques and anxiety management apps that many people find useful. Crisis intervention strategies are crucial for mental health emergencies. Key techniques include de-escalation, maintaining safe distance, calm posture, active listening, providing a safe space, and connecting individuals to resources. The primary goal is to stabilize situations, ensure safety, and link individuals to necessary support. Maintain a calm presence by speaking softly, slowly, and clearly, controlling your own emotions and body language. Respect personal space by keeping a safe distance and not blocking exits. Use simple, clear communication, offering one request at a time. Provide simple choices to help regain a sense of control. These techniques aim to de-escalate emotional intensity and prevent situations from worsening. Key physical safety considerations include assessing risks, hazards, weapons, self-harm, strategic positioning, between person and door, don't block exit, removing bystanders to reduce stimulation, and having a safety plan, when to call for help or involve security. Always prioritize personal safety. If unsafe, remove yourself and get help immediately. As responders, we need to be mindful of our own mental and emotional well-being. Providing mental health first aid can be taxing, so self-care is essential. It's important to recognize your limits, understand your emotional capacity, and know when to step back or seek support to avoid burnout. Practice grounding techniques like deep breathing or the 5-4-3-2-1 method to stay present and manage immediate stress reactions. After challenging incidents, debrief by discussing them with a supervisor, colleague, or mental health professional to get the support you need. Maintain clear boundaries. Remember your role is to provide first aid, not ongoing therapy. Set limits to protect your own well-being. His highlights the importance of referrals and follow-up in supporting mental health. The image depicts a supportive person guiding someone to mental health resources on a smartphone, in a comfortable office setting. Referrals to appropriate services and professionals are crucial for connecting individuals with the right support. Regular follow-up, whether through check-ins or continued care, helps ensure individuals receive the ongoing assistance they need. Emphasize the accessibility and availability of these resources to make it easier for people to access the help they require. Encourage the audience to be proactive in seeking referrals and following up, both for themselves and for those they care about. This provides an overview of essential mental health resources that can be accessed in times of need. It covers both emergency resources, like hotlines and crisis teams, as well as non-emergency support options, such as GP services, mental health charities, and workplace/educational well-being programs. Emphasize the importance of having this information readily available, as it can be crucial during mental health first aid situations. Encourage the audience to create a physical or digital resource card with these contact details to share with others who may need it. Highlight that these services are available 24/7 and can provide vital support and guidance in difficult times. Recommend that attendees take a moment to familiarize themselves with the resources on this slide, so they are prepared to assist someone in need. Making effective referrals is crucial for connecting people to the mental health resources they need. When making a referral, consider the person's specific mental health concern, how urgent it is, and their personal preferences. Provide detailed information like names, phone numbers, websites, and what to expect from the referral offer. Practical support like helping them make a call, schedule an appointment, or find transportation. Discuss and address any barriers they may have, such as concerns about cost, stigma, or previous negative experiences. Be prepared for initial reluctance. Many people need time to consider seeking help, so gentle persistence and consistent support can make a big difference. Documentation and reporting are crucial aspects of providing first aid and emergency response. Creating clear, factual records helps ensure continuity of care, provides important information to professionals, and protects both the individual and the first aider. Key things to document include the date, time, and location of the incident, observable behaviors and statements, not interpretations, actions taken, resources provided, and any follow-up plans. Confidentiality is paramount. Follow your organization's protocols for secure documentation and only share information on a need-to-know basis, except when safety is at immediate risk. Thorough documentation can also help identify patterns requiring further follow-up. The journey of recovery from mental health challenges is often ongoing, not a single event. After providing initial mental health first aid, it's important to follow up appropriately. Check in sensitively with the person, showing you've been thinking about them and asking how they're doing. Respect their need for space and boundaries while maintaining an open door for support. Gently encourage them to continue seeking professional help, reinforcing the importance of that. Notice and acknowledge any positive changes, but don't overemphasize them. Treat the person with the same respect and inclusion as before, maintaining normalcy. Remember that recovery timelines can vary greatly between individuals, so be patient. This highlights the importance of cultural and ethical considerations in our work. The image depicts a diverse group of people in a supportive circle, representing different cultures and backgrounds, in a community center setting with cultural symbols subtly visible. This reflects the need to be mindful of diverse perspectives and to approach our work with cultural sensitivity and ethical integrity. Key points to emphasize: acknowledging and respecting cultural differences among stakeholders and end users, ensuring our solutions and processes align with ethical principles and values, fostering an inclusive environment that welcomes and empowers people of all backgrounds. These considerations are critical to building trust, driving meaningful impact, and upholding our organizational values. Mental health beliefs, expressions, and help-seeking behaviors can vary significantly across cultures. It's important to be culturally responsive when providing mental health first aid. Key cultural considerations include beliefs about causes and treatments of mental illness, communication styles and norms around emotional expression, family roles and involvement in mental health decisions, religious/spiritual practices related to healing, historical trauma or distrust of healthcare systems, language barriers, and interpretation needs. The key ethical principles in mental health first aid are confidentiality, autonomy, beneficence, non-maleficence, competence, and duty of care. Confidentiality means protecting the person's privacy, except when safety is at risk. Autonomy is respecting the person's right to make their own decisions. Beneficence is acting in the best interest of the person. Non-maleficence is avoiding causing harm through action or inaction. Competence is staying within the bounds of your training and role. Duty of care is taking reasonable steps to prevent foreseeable harm. These ethical principles help guide responsible mental health first aid practice and navigate complex situations. Confidentiality requires ethical judgment. Maintain privacy for general mental health discussions. However, safety is paramount. Break confidentiality for imminent risk of suicide, self-harm, threats to others, or abuse of vulnerable individuals. Always document your rationale and consult supervisors if unsure. When disclosing, share only essential information to prevent harm. Workplace applications demonstrate mental health first aid's practical value in professional settings. Following traumatic incidents, create supportive environments where staff can process experiences safely. Use psychological first aid principles to validate emotional responses, whilst connecting individuals to employee assistance programs. When colleagues display distress indicators, initiate private conversations using ALGE methodology. Remember that workplace mental health support requires balancing individual needs with organizational policies and professional boundaries. These key takeaways consolidate essential learning points. Mental health first aid represents accessible community skills rather than professional expertise. Anyone can develop competence through proper training. The ALGE framework provides systematic response structure during emotionally challenging situations. The initial 24 hours following crisis onset prove critical for establishing safety and connecting individuals to ongoing support. Your role bridges immediate crisis response with professional therapeutic intervention, creating vital support networks within communities. These discussion questions help consolidate your learning and prepare you for real-world application. Consider the unique challenges within your specific environment. Workplace dynamics, community needs, or organizational constraints may influence your approach. Cultural competence requires ongoing development and self-reflection. Identify your available resources now, before crises occur. Ethical dilemmas around confidentiality versus safety require careful consideration of circumstances and consultation when uncertain. Finally, sustainable helping requires robust self-care strategies to prevent burnout whilst maintaining effectiveness. Your commitment to mental health support goes beyond formal training. These skills are vital for community well-being, showing how individual actions create broader social impact. MHFA competencies offer meaningful support in personal and professional contexts when others face distress. Continue developing these skills through practice, reflection, and ongoing education. Thank you for your dedication to supporting mental health in your communities.